Hey, everybody. This is Dan with Pain Free You. And today I am with Megan Evans from British Columbia, Canada. And she's agreed to share her story. I guess she saw a post or another success online, and she says, oh, here's my situation. I've recovered and I'm doing very well. And she volunteered after I asked her to kind of come online here and share her story with you guys and gals. So Megan, why don't you just kind of jump right in and let everybody know kind of where you've been, what you've experienced, ideally at what point you figured out, this Dr. Sarno mind-body concept, some of the things you've done there, because everybody always asks, well, what exactly did you do to get better?
Yeah.
And so if there's any information you're willing to share there, that would be great. So have at it. What's going on? Where you been?
Well, thank you for having me, first of all. And I think after doing some of the work, I realized that I've had TMS for the majority of my life, probably since around 10 years old. I actually had knee pain at age 10, for which I needed physiotherapy. And I was also told I would have to wear orthotics for the rest of my life. That was not something that great to lay on a 10-year-old. But it just sort of went from there. And then around age 16, I developed back pain. And I remember going to my dad's chiropractor. And eventually they did take an x-ray. And I remember the technician saying, oh, were you in a car accident? And I'm like, oh, this is going to be fun.
That's never a good thing. And how old were you then?
16.
Nice. Okay.
And so I did see like a surgeon and all that. And I did actually have a spinal fusion at age 18. And that was quite stressful. I must admit that was quite stressful. And in those days, they didn't really offer any type of counseling or they didn't really take into consideration people's feelings or emotions behind that. They just did the fusion and said, oh yeah, that looks great. You're all done.
Good.
Ready to go. Bye. And and you'll be kind of limited and it might get worse as you get older. As you age, it's going to get worse. I've always been told that one. And around the mid-20s, I did end up getting chronic lower back pain. Like it was okay for a few years after the fusion. But I did find that I developed chronic back pain in my 20s. But they said that the fusion was solid and all that kind of thing.
Okay.
And
you mentioned the diagnosis before we started. So what was that?
Spondylolisthesis.
Okay. I just want to make sure people realize
it's a mouthful.
That was the official diagnosis, because there's a lot of people who hear that from their doctors, and I just want to make sure that is kind of stated for the record here. That
I had high grade 3 spondylolisthesis in the L5-S1 area. So that's where my fusion is. So gotcha. I think it's like seven screws, 2 plates, 2 rods.
Wow.
So I did have pain in my 20s after that. It's been kind of an ongoing thing, having the lower back pain.
Okay.
And for most of the life, I've actually walked with a limp. And flash forward like a few years when my nervous system really did go to pot and everything really got very amped up. It was around 2015. And it did begin with coccydynia, which is tailbone pain, unexplained tailbone pain. And sitting was just excruciating. It did feel like if I was coughing or if I was laughing, it felt like I was sitting on a knife almost. It was very, very sharp pain in the coccyx. And then I'm not sure what even triggered that. I think it was probably related to some type of emotional event that occurred around that time. I think that's probably what caused it.
Were you able to connect the dots between stressful times?
Yeah, when I realized what it was I was actually dealing with, a lot of my symptoms, I could connect the dots. It was like a map. I wrote it down, like, oh yeah, there's that with that. When my mom died, I had, I ended up with plantar fasciitis a couple months after that. I had that for a while. But yeah, I could definitely connect dots between physical symptoms emerging after a traumatic or a stressful event.
Yeah, but at the time, nobody ever makes those connections. It's only in hindsight once you hear about this Dr. Sarno and the mind-body connection.
Exactly. And then it just sort of made sense for my whole life, actually. It's, yeah, it really did. Once the dots started connecting, I'm like, oh, yeah, that makes a lot of sense. Because a lot of the symptoms I had to me never, ever made sense. Right. Like, it was just like, it's amazing how many symptoms you can have. And it's the nervous system is so ramped up. Right. I think I must have spent years in fight or flight because the symptoms were all over the place. And of course, another event that occurred that was stressful was a motor vehicle accident. I was in that too. So I did recover from any type of physical injuries, but of course it was lingering. Pain was lingering beyond the usual recovery date. So,
okay.
And
so at what point did you start to, at what point did you hear about this Dr. Sarno, the mind-body syndrome, the whole connection between our emotional trauma, stress world, and physical pain?
Mm-hmm. I didn't learn about that actually until 2020. Oh, wow. In about a year. I've been doing it since July 2020.
Okay.
And it did explain a lot of all the symptoms I was having.
So you had decades of pain and symptoms, and now just in about a year's time, you're doing considerably better.
Oh yeah, definitely. Yeah, even the lower back pain is considerably better. Awesome. Yeah, I don't really have any issues now with having spondylolisthesis.
So just curious, how did you find out about this, Dr. Sarno?
I was in one of those really, really depressed support groups that are on Facebook. There was a link that somebody added, and it was actually to Nicole Sachs's YouTube video. And I listened to her, and I actually probably wouldn't have listened to her if she hadn't mentioned having spondylolisthesis.
Right. Yeah, that was her diagnosis.
Yeah. So I figured if somebody has a normal life with spondylolisthesis. So I immediately listened. And I did do her course. That was the first one that I did. And a lot of emotional stuff came up when I started doing that one. And I did start to connect the dots about why my body is retaining pain. And it did have a lot to do with like emotion, like a past childhood trauma, and also personality traits. Because people being a people pleaser, that does not always work to one's advantage. So,
when we look at it, the personality traits develop based on those early childhood experiences. Like we'll experience something traumatic as a child, and
exactly. Yeah. In my household, it was my mother who couldn't actually regulate her emotions. So I would be basically in the firing range of all of her rage. So I did learn early that anger is a dangerous emotion.
Yeah, but also those people-pleasing tendencies created as a coping strategy and a survival strategy as a child.
Exactly.
So you were not subject to rage or
exactly.
So okay. And so you did Nicole's program. And how quickly did you start seeing some results from that? I know you said you connected the dots. A lot of stuff came out.
things got quite stirred up before they got better.
So the symptoms went a little haywire?
Yeah, they were all over the place. They were every other day was something new. It's like, oh, something here now. And then, oh, my feet are hurting again. And it's like, it was all over the map for the first little while. And I think that's just because I was just drudging up a lot of emotional energy that hadn't been dealt with throughout my life. So that definitely made sense to me. Probably about a month or two, then I started noticing an improvement.
That's great.
And then from her site, I did actually start watching your videos, which was really good. Because my mantra now for waking up in the morning is, how much fun can I have today? Rather than thinking,
that's funny.
Can that happen today? To put a more positive spin on things.
And when you start to do that on a regular basis, you actually find that with that intention for the day, it's much more likely that you're going to notice opportunities to actually engage in the world and have some fun. Because if you certainly start your day with, oh crap, here we go again, how bad's today going to be? Your brain's going to find that too.
Oh, yeah.
So the intention, that's fantastic that you started doing that. And
I found that was really good. And also just focusing on, I guess, reducing the fear. Because I did find that the fear and the rumination and the catastrophizing absolutely was feeding the pain. Absolutely. And especially when they didn't know, especially when I didn't know it was pelvic floor dysfunction, because there was just a burning sensation in my bladder 24/7. I couldn't help but being freaked out about that.
So when did you start getting pelvic and bladder issues? How long ago was that?
That was probably 2018, 2019.
Okay. So you had that for a couple of years before you...
Yeah, about a year and a half.
Okay. And so as a result of this mind-body work, have you been able to resolve that stuff as well as the pain?
Yeah, I haven't had any symptoms. And I remember it kind of was threatening to flare up one day. So I just said, okay, go ahead, do your absolute worst. I don't mind. And it went away. Yeah. It did. It went away very quickly because I was just like, okay.
Do you know why it went away very quickly?
Because I no longer feared it.
Exactly. That's exactly right. Because these TMS symptoms, regardless of where they are, they feed on fear and the attention. And you basically said, bring it on.
Yeah. It's like,
care.
Yeah.
And the only reason you're able to do that is because you had a lot of clarity as to exactly what was causing them in the first place. So you gained the clarity. So when it showed back up or started threatening to, you basically said, I don't care. Do what you want.
Exactly.
And the brain says, oh, I guess she's okay. She's safe. She's not in danger. This is awesome. And decided to kind of leave you alone.
Yeah, I've been good for several months now. But I remember when
life.
Yeah, exactly. Yeah.
Okay.
But I do remember there was a lot of fear around that particular diagnosis. Like I would cut things out of my diet thinking it was irritating things. And I was afraid to eat anything. I was just.
Are you eating more normal foods now?
Oh, yeah. Yeah. Nothing's coming between me and my morning coffee, not even my nervous system. So there's no way. So, but yeah, I did cut that out for about a year.
And how limited was your life based on the several years of pain leading up to finding out about it?
I think it was very limited. I mean, I was high functioning, like working full time and exercising a lot, but I don't know, it was sort of make me feel like I'm living small.
Right.
Almost like there's nothing beyond what I do every day.
Right. So you're kind of getting out of your shell a little bit more.
Yeah, absolutely. Yeah, I've been doing more
having fun.
Yeah, I get out a lot more. I do walks because I enjoy them in nature.
That's
And yeah, I put myself in a lot more social situations. And yeah, I'm just doing it gradually, so don't overload my nervous system, because it can sometimes flare up like, oh, what are you doing? Like, oh, you're going out. It's like, okay. If you flare up, sure, you can come along, but I'm doing it anyway.
Well, that's a great mindset.
Yeah.
I'm going to do it anyway. So if the symptoms want to come along, so what? And so I think when you stop avoiding the things that you used to avoid when you were in the thick of it, that's when you start to really challenge the symptoms and go, I'm not overly concerned with you, so I'm doing this. And if you're there, great. If you're not, great. And that really epitomizes that whole concept of indifference that I share all the time, which is, okay, I've got symptoms today. So what? Because you've got the clarity that you're not actually broken, which means you're not at risk of damaging yourself.
That's true.
And we learn through this process that sensations, while they are uncomfortable and unpleasant and not great, they're not harmful. And when you get to that point of clarity and you start to look for opportunities to live more and enjoy yourself, and look, no debate, you did some of the emotional work and were able to get some of that. How much would you say it was the emotional work versus the whole mindset concept of really accepting I'm not broken and proceeding accordingly, versus how much of it was the emotional release and digging that you did?
I think probably about 50-50.
Okay. No, that's great.
Definitely emotional stuff, but also I think my nervous system was so defaulted to fight or flight. It didn't know any other way. And I certainly never heard of mind-body stuff. So of course I wasn't doing any type of self-soothing until I knew that would definitely help.
And when did that kick in? Was that part of Nicole's doing the 10 minutes of meditation after the journaling, or did you get more into it a little bit later?
A little bit later. I did do Dr. Schubner's after that too, because I felt like there was still stuff that needed to surface. So I did do that one as well. And I liked his type of journal speak where you brainstorm for like 5 minutes and then do.
Right. Expressive writing, free writing.
Like I'm feeling this way because, and then the understanding afterwards. I kind of liked that structure.
Very nice. What else would you want to share to somebody who's watching this? Is there any other lessons learned, cautions, encouragement that you think you'd want to make sure people hear about?
I definitely encourage anybody who has like spondylolisthesis, for example, or pelvic floor dysfunction, or even I was also diagnosed with occipital neuralgia, which is a headache disorder. So, and the mind-body work did help with all of those.
Yeah.
So I encourage anybody to at least give it a try. And if you don't, and even if like I don't really have any further expectation of symptom relief, but I do like the fact that I learned a lot about myself. Mm-hmm. So I think that that's a real benefit. It's like I thought I knew myself, but no, I didn't.
And now you do better.
Yeah.
That's great. Yeah, there's definitely a lot of side benefits to going through this journey. And I don't like to say this because people are like, oh, no way. But a lot of people that have come through the journey realize that at a certain point in time, they can see this whole process as a gift. Mm. And while it was not fun, it was pretty horrific while you're going through it. At the end of the process, when you kind of realize like, wow, I'm really not broken. And I'm only I only got where I was because of what I went through in my past. it wasn't your fault. It was just kind of where you ended up. That realization is very freeing. And we can start to kind of forgive ourselves and get rid of the self-blaming that we've all been doing for so many years, and self-criticism. And so it truly can be a gift if you allow it to be, and kind of set aside some of the self-criticism and judgment that many of us have done for a long time.
Yeah, absolutely.
Very cool. Anything else you can think of, or kind of wraps up your journey?
Well, I'm trying to think of what else I did that sort of brought down the fear, because I was very, very much in a fear state. I named my pain, which actually,
do you want to share that or no?
Oh yeah, I made it kind of a running joke. I named my pain Darling, which is the character from the show Blackadder. So every time I start ramping up, I hear Stephen Fry's voice in my head saying, "What is it now, darling?" So I can actually laugh about it, and that really diffused a lot of fear.
Yeah, because what I found with a lot of people is that if they can notice a pain and smile at it or laugh at it,
yeah, exactly.
It's very amazing how very quickly the pain can just kind of settle down.
Yeah.
Because the pain is typically a response to a perceived danger, whether it be emotional, physical, movement, any number of 1,000 different things that might perhaps bring on somebody's pain, but it's a perceived danger. And that's when the brain goes, oh, our warning signal is pain, so let's turn that on. And when you can smile at that warning signal, it's kind of like going, you can turn off the fire alarm. There's no fire here. We're okay. Look, see, I'm smiling. And by laughing at it, or hello, darling, joking about it.
Agenda today, darling.
And so you're right. It quickly diffuses the entire ramp up process, which before we understood all of this, we could get a little twinge that turns into a big flare, simply because the minute we felt a little twinge, we went straight to the freak out, as opposed to the I'm not bothered type of approach. So that's great.
And when I get twinges now, I think that I think to myself, yes, this is transitory. This is not permanent. This is just a transitory thing. It's just a blip in the nervous system, and it will pass. That really helped with the headaches, because that one was probably the most defeating feeling, was headaches, because they were 24/7 for a year. So that did take a long time to diffuse the fear around that.
I like that word, transitory, because
fluid. I sort of use its wording from Curable's app, is that it's fluid. You feel it and it moves out of the body.
And if you like the acronym TMS, then it's transitory mind-body syndrome. Or, as I did a video a while ago, temporary mind-body syndrome, which is same meaning. That's very cool. What else? Anything else you want to share?
I'd highly recommend the Curable app.
Very cool.
Yeah, it's got great meditations and exercises.
Yeah, and the education component in there is very strong.
Yeah, that was really good. I enjoyed that. And what else would I recommend? Yeah, definitely the Curable app. And also the Curable boot camp. Okay. I did actually take that. And that was good, because I didn't feel like I was isolated anymore. Like there was other people that were experiencing chronic pain. And it was just nice to come together in a group and meet that way. And actually the group that I was in still meets.
Okay.
Weeks.
Very cool.
That was nice. That was just an extension. That was a nice support group.
Okay. Yeah. And just a blatant sales pitch. Curable boot camps, very, very good thing. I've got a lot of respect for Curable, but I've also in June set up a group program where weekly we get together on Zoom chats, and there's also an online video course which people can get kind of like a fast track of all the core concepts that I suggest. So the course is there, weekly groups, Zoom calls, and I do that twice a day on Wednesdays. So 1 p.m. and 7 p.m. And the reason for that is because I've got a bunch of people in Europe, and so they can deal with the 1 p.m. because if they have to show up at 7 p.m., that's at like 2 a.m. for them.
Yeah.
And so that doesn't go too well. So just a blatant pitch.
Mm-hmm.
But you are right, though, that the feeling of not being alone.
Yeah, that helps.
Chronic pain can be fairly isolating, that friends don't get it, family don't get it, partners don't get it. And, you kind of feel like, holy crap, is there anybody else out there like me? And when you participate in a group like that, you actually realize, wow, there's a whole bunch of people like me. And then you show up and you have the support. And these groups don't have to become about complaining about symptoms. As a matter of fact, I won't let my groups turn into symptom complaint sessions because that doesn't get anybody any better. But it's almost like when somebody says, okay, I've got this going on, what do I do? And I'll answer some questions, but then other people will chime in and be like, oh, I went through the same thing and this is how it worked out for me. And yeah, it's going to turn out great. And so, yeah, the group, whether it's curable groups, boot camps, my stuff, try to get into a good support environment. And as Megan was saying earlier, there's some really depressing pain groups out on Facebook. And if you're in any of those, get out. They're not, some of them are just totally full of people who are in complete despair, have zero hope. They don't understand this mind-body concept. And those groups can be really triggering and really set your whole mindset that this is the rest of my life. Mm-hmm. So if you're in those groups, get out of them. So that's great. Anything else?
I did want to mention one of my favorite videos of yours is the I'm Not Broken video. Awesome. That, and I was like, I'm not broken. Like it was actually quite a relief to actually think that way. It's like, oh, I'm not broken. So it was just kind of nice. Because I feel like throughout my life, it's sort of I've been fed bad data. And I do like the analogy of bad data because
I say that all the time.
That is very, very true. And just to think of yourself as not broken, it's like, oh wow, there's nothing to fix. Yes. It's kind of exciting because I actually am excited about the rest of my life. I really haven't felt that way before, actually being excited that, oh yeah, there's a whole bunch of possibilities that are laying before me. I'm sort of reinventing my life right now anyway.
You can basically design your future.
Yeah.
Who do I want to be when I grow up?
Exactly. That's what I'm thinking. It's like, what do I want to be?
What do I want to be? What do I want to do? And not have to frame it through this lens of feeling broken and limited.
Yeah.
So that's really incredible. Come a long way.
Yeah, I think I have. Yeah, I think there's still some stuff that's working out in my body, but I would say probably I'm 90% there. There's just a few minor things still to work through, and just sort of retraining the system. I know it really likes to default back into fight or flight. And I do catch it. I'm like, nope, you're gonna relax your physical body and you're going to just relax your mind.
Yeah.
When that happens, and I do have to stop myself and do that. And if I do that, the symptoms do go. Yeah. But if I just set aside and ignore it, it will actually get worse. So that's why
I don't suggest we ignore the symptoms at all, because they will get your attention.
Yes, they do.
But it's how we choose to respond to it. And like you said, you've learned and are continuing to practice this calm, relaxed, breathe, gentle approach. Because the more we fight the symptoms, the more they fight back and the longer they stick around. And so that's great.
Mhm. And I don't really do, I mean, I did journal speak for maybe the first 4 or 5 months,
Okay.
but I actually liked your way of doing it better. Just the open house with the emotions, just, okay, what am I feeling today? And just doing it that way. That way you can do it anywhere. You can do that in your car, or you can do it while you're walking, or just to check in, or just to check in. Yeah, when I wake up in the morning, what am
Yeah,
I doing?
general awareness. Like I'm
Yeah,
feeling emotionally
exactly.
elevated.
Mhm.
What's going on? Allow it. And
Yeah.
then before long, you feel it, you experience it, and it releases. And you're not accumulating these emotions throughout the days and weeks and months to the point that you want to blow up and scream at people. You just allow yourself to experience it. By doing this, it's almost like exposure therapy to emotions, which teaches your brain that even emotions are safe. So, very cool. Well, this is
Yeah.
great. I love what you've had to say. For anybody who's watching, Megan's proof that when you can kind of jump into this and accept and understand what's going on, and
Mhm.
seems like she really accepted that core message, which is relax, you're not broken. And when you can truly get that from the thinking brain to your heart and wisdom, that's when all of a sudden the fear can dissipate, and the concept of indifference and joking with the pain and giving it nicknames and telling darling to make it worse and
Exactly. I was like, go for it. Yeah.
give me all you've got. And I did a video called Bring It On. And some people have tried that and they've had very good results with it. A couple of people were like, are you crazy? I don't want to do that. And they're terrified because they're just so afraid that it's going to make it worse. And that's the thing. The fear is what's driving it all. So
Yeah.
when you realize that you're not broken, there's nothing to fear, it's just sensations and they're temporary, transitory, um, life gets a lot easier and the
Mhm.
whole system can settle down fairly quick. And you've actually had very good results in, you know, within 1 year, but you said you started noticing results sooner than that. It's been a little bit of a work in progress.
Mhm.
Um,
Yeah.
but the one thing I will point out to anybody watching is, Megan did not treat individual symptoms. She treated
Mhm.
the whole thing, her brain, her nervous system. The brain took care of letting go of these symptoms one by one, this by that, and just
Mhm.
it. It's an overall message of safety, and I'm okay. And it's not like you're saying, okay, I'm going to treat my headaches, because if you're doing that, you're thinking about your headaches and neuroplastic pain. If you're thinking about it, it's kind of still sending
Mhm.
those neural circuits. So we just
Mhm.
want to send the message of safety. I'm okay. I'm not concerned with you, darling. And when the brain gets a message that you're actually okay,
Yeah.
actually things settle down. And Megan's proof of this. So if you've been at this for a long time, just understand some of these subtle shifts that really allowed Megan to make huge progress from feeling very limited and very broken to feeling very much like, hey, what do I want to do when I grow up?
Yeah.
What do I want to be?
Mhm.
What do I want to plan for my future?
Yeah.
Very cool stuff. You
Mhm.
must be very pleased.
Yeah, I actually am. I'm actually really proud of myself for managing to do that for myself. And yeah, I did do it all myself. There's no doctors involved. So, um,
Exactly.
yeah, it was all me. And yeah, I'm very proud of that.
That's
Because
awesome.
I didn't think it would be possible. So, yeah, for some reason, I thought the spondylolisthesis diagnosis would be very limiting for the rest of my life. And it's not. I actually walk now without a limp.
That's
Um,
great.
my hips are fine. Everything moves very fluidly now, actually, when I walk.
Yeah.
It's
So
great.
anybody who's had prior surgeries to correct the problem in the past or perceived problem, because we don't really know whether or not that was absolutely required or it was just a result of, you know,
Yeah.
symptoms. So let's do surgery. So for anybody who's gone through any of that stuff, there is life after even fusions. And Megan's proof of that, because a lot of people have this belief that, oh, well, I got back surgery, so now I'm really messed up. And that's not necessarily true. We can still teach the brain that the body's okay. You've already healed from the surgery. Everything is as it should be. So trust the body. It knows what to do. And, when you teach that to the brain can absolutely settle itself down. And as a result, the nervous system settles down and you can end up feeling as good as Megan does. Beautiful.
Yeah, I'm very pleased that I've made it to this point. And I actually feel really good that I actually got to meet myself, because I don't think I ever really met myself in life until I really started doing the work and really finding out about myself. So that, to me, that's really exciting.
You kind of figured out how you got where you got. In other words, because prior to that, a lot of people think I'm broken emotionally and physically, and I'm a mess. And that's kind of how they view themselves. And, through this journey, many people, and it sounds like you, have kind of realized okay, none of this was my fault. This is just where I ended up because of all the crazy stuff I went through growing up. And now you're kind of saying, you know what, I'm all right. Physically, emotionally, mentally, I'm all right. And when the brain gets that, it's wow. A whole new life is available to us. I like to view this as kind of like a new software version of ourselves.
That's right.
Megan 2.0. And I joke that I use my age. So I'm like Dan 5.6 because I'm 56 years old. I'm not asking you your age and you don't have to share that, but whatever software version it is, it almost feels like you've got new software running.
Mm-hmm. Yeah.
That's great.
Yeah.
Unless you've got anything else, I think this was fantastic. I think the people watching are going to really love it. Anything else?
No, I can't really think of it. I think we've touched on most of everything.
Awesome. Well, Megan, I really appreciate it. And I'll let you know, or if you just keep an eye on the Facebook and the YouTube, you'll see when it posts. But I really, really appreciate you doing this. You're going to help a lot of people out by sharing your story, your journey. And I think a lot of people are going to start calling their pain darling now.
Yeah, I like it. It makes me smile every time. So
that's wonderful. And, that's really, that's a cool idea. I like it. So, all right. I really appreciate it. Thanks for sharing your story, and, keep an eye out. It'll be posted soon.
That sounds good. Well, thank you very much. And thank you for all you do.
All right. Take care, Megan.
Thank you.